Welcome. This is Dr. Michael Carter talking to you today about the Cattle Health Annual Cooperative Agreement material for the annual training. This would be for the umbrella agreements. Basically, what I'm covering today is the cattle health goals, the sections that's within the grants and agreements guides. It is part of the umbrella agreement, and this year there has been a few changes to the outline and the goals and the objectives. We're making some of the things a little bit more specific, and that's kind of what I'm covering today, along with some of the reporting templates that we'll see. So as far as the cattle health surveillance and outreach goals, the surveillance objectives primarily stay the same as last year. It's looking at, domestic cattle and bison, and targeted high-risk wildlife populations to maintain this, national, state, and herd health disease status certification programs. In addition to all that, the funding is to be used for responding to outbreaks in cattle and bison, and of course any outreach efforts that would complement those program activities. Just one thing of note, for animal disease traceability activities, that should be covered under the ADT cooperative agreement and not here under the umbrella agreement. So getting right into it, specifics for the programs, we'll start off looking at brucellosis. We kind of have this broken into two categories. One for the 3 GYA states, Idaho, Montana, and Wyoming. Obviously, they've got a lot more surveillance activities going on in their state to implement their brucellosis management plans that they have in place. They're also implementing risk-based management plans for individual farms within the high-risk area. We also want them to conduct at least one meeting between the state animal health livestock officials and the wildlife officials. Obviously, we would hope that the APHIS office is included in that, but we want to at least have some meeting between the livestock officials and the wildlife officials. We do want to encourage abortion screening in the cattle, and then, of course, conduct any epidemiological investigations and other programs that fit into that brucellosis management plan. For the non-GYA states, obviously education, just awareness, continues to be a priority for us, as well as encouraging abortion screening in cattle. Since we've reduced a lot of our national slaughter surveillance, we are looking at abortion screening to kind of cover that gap, and so we're very much interested in seeing that being done, as well as for any brucellosis investigations that pop up as necessary, whether it's trace outs or any other activities of concern for brucellosis. For BSE, and this pretty much goes for all states, the BSE program has a national sampling plan. Any sampling activities that the state wants to do, we want to make sure that that ties into that national plan. And so I would encourage states, if they're interested in doing that, to, one, talk with the area office and also get in touch with our BSE coordinator, Jose Urdaz, to kind of make sure that any activities that they want to do is in alignment with that national surveillance plan. In addition to any sampling that a state might want to do, we do want to continue conducting outreach and education to accredited veterinarians and producers to encourage sample submissions, and likewise, conduct outreach and education with the public health officials and laboratory directors about forwarding rabies negative submissions from cattle to get them to NVSL for BSE surveillance. Cattle fever tick program, obviously there's really only 2 states that we would expect to see anything coming in for cattle fever tick, Puerto Rico, and it's primarily to provide any fever tick program data that the Puerto Rico collects, and submitting any ticks for identification and NVSL. We'll cover that, and then of course, collaborate with any APHIS ARS joint in research that's going on. Texas, obviously a lot more activity going on. Conduct targeted surveillance outside the permanent quarantine zone. Coordinate wildlife hunting surveillance with the local, state, and federal entities in the area. Continue to provide tick submission and program data, and then conduct other surveillance disease testing that as stray animals are captured from across the border. We want to continue working with our collaborations with Mexico, and of course collaborating with the white-tailed deer census in the cattle fever tick zones, and of course again collaborate with APHIS ARS on joint fever tick research. For these collaborations with APHIS ARS, I would encourage the states to work closely with Denise Vanilla, who is our entomologist on staff and is kind of overseeing those type of coordination activities. Tuberculosis, again, we kind of have two broad categories for brucellosis this year. One is activities that we kind of expect all states to be doing, and that is one, visiting state-inspected slaughter establishments to validate kind of the slaughter inspection process that's going on in those plants, conducting outreach training and education for accredited veterinarians to ensure compliance with the existing performance standards, the performance standards for the caudal fold test response rates. We want to make sure that each state has a system in place to monitor the caudal fold test response rates, so that they have something to compare to, and of course report data on that. Conduct any epidemiological investigations as appropriate, as traces come in, and then provide travel funds to cover the travel costs for states VMO's CCT training, and of course this is referring to the training that we have in Ames, Iowa, to be able to get the state VMOs there for those training activities. For states that have detected bovine tuberculosis, there's additional areas, and that's conduct targeted surveillance in the areas where the TB has been identified, implement any herd management plans and management strategies within the state, implement the statewide risk-based management, and this is really to create a plan to to support the response efforts when the TB has been found, and then if necessary conduct wildlife surveillance to determine if TB is present in the wildlife, and then of course for those areas where we find it, we'll definitely be working with APHIS to identify strategies that we can do to reduce or eliminate the TB presence in wildlife. Other program activities, this includes assisting VS in bringing the slaughter plants and the rendering plants into compliance with the blood and tissue collection rule, or assisting with conducting quarterly inspections. We don't expect this to be occurring in a lot of states, but there are some states that really do help support VS in this role, and so that would be part. Reporting and data entry, again, this is an area where it's kind of a baseline activity. One is doing the monthly reports for NLRAD and NARS, particularly as NLRAD comes online in the future, but it's getting those NARS reports in on a monthly basis, and then of course any other data entry that the state is doing for the VS office, and that includes any data entry into EMERS or the SES system, or any of the laboratory getting that data to VS as required. And then, preparedness and response activities. Again, I think everybody's familiar with these, but it's preparing and maintaining state-level plans and actually exercising them, investigating and controlling or eliminating any emerging or endemic, zoonotic, and FMDs. Is basically it's investigating and responding to any of these disease outbreak situations. And of course, implementing risk-based management plans as they're identified within the state. As far as reporting goes, there is surveillance data that's reported on a quarterly basis, and basically what we're looking for is states to supply that surveillance and outreach data to the area office so that they can kind of collate that data and get it submitted. These are quarterly reports that the cattle health staff is looking to get to kind of monitor all program activities, and it would be kind of collected in the cattle health data reporting spreadsheet. And then this data should be submitted through this data that's submitted through the surveillance and activity worksheets. It can and probably will be used to inform future decisions about funding levels going into the future to kind of get a better handle on what activities are being done in the state and what times of the year these activities are being done, and so it gives the cattle health group a better understanding of a little bit more of the flow and activity within the state. This is just a snapshot of that quarterly reporting spreadsheet. It doesn't include all the categories, but just kind of gives you a format. We have it broken down into quarters, and of course that is going to add up to a yearly total during the course of the cooperative agreement. The intent of collecting the data in a quarterly fashion as opposed to just a yearly total is we typically report data out in two different formats, one by a fiscal year and two by a calendar year. And by having it in a quarterly basis, it allows us to be able to present the data however it's needed depending on which stakeholders is asking for that data. And so this is the spreadsheet that the area office is going to be filling out. This is the data that we need filled in and the support from the state to actually get the data into this system. As far as the narrative reports, I'm sure the cooperative agreement staff have talked about this more, but it's our recommendation is to follow the spreadsheet format that they've developed, and it kind of breaks it out into the goals for the various program areas that the state was interested in doing. The proposed activities, obviously, that's something that the state would fill in, and of course, those narrative quarterly accomplishments would be filled into the other blocks to make it just a little bit easier to follow what each state is doing, each quarter. Again, it's supposed to be very brief accounts of what's going on. We're not looking at huge long narratives to follow as we go through for these quarterly reports. And so there's the possibility that you can embed the data, surveillance data into these, but we'd also like that data to be incorporated into that quarterly surveillance spreadsheet. Of course, you can go ahead and just give the data to the area office to fill those in. And so if there's any questions or comments that you have, you can address them to me at michael.a.carter@aphis.usda.gov. Again, if there's specific program questions, I'll either answer them or get you to the appropriate staff officer to be able to address those. So with that, I thank you for your time and looking forward to answering any questions you might have. Thank you.